Welcome. This is Kim Sandifer, and I'm here from Hurst Review, and I'm so glad to have you guys with me. We are going to do a question together, and I'm going to talk you through the rationales and the right answers, the wrong answers, and all the things. Before we get there, though, I want to talk to you just a little bit about your NCLEX test. So your NCLEX test, well, what happens if you don't pass the test the very first time? Your odds of passing decrease, and you're like, oh my gosh, why is she telling us this? Why is she trying to scare us? Y'all, I'm not trying to scare you. I'm wanting to let you know that you need to prepare for this test. Even the National Council for State Boards of Nursing, who are the people that write the test, say that you should take a formal review. And what is meant by a formal review? It's a review like Hurst Review offers, where you take all this core content, you bring it back to the forefront of your mind, and you review it and you get ready for this test. This is a difficult test. You would never want to walk into this test and just be like, oh, I'm going to take a chance and kind of see how I do. You do not want to do that. Your odds of passing decrease. And let me tell you what they decrease to. They decrease to around 40%. And you're like, oh my gosh, why is she telling us this again? I'm telling you this so that you prepare and that you prepare well. And maybe you've already taken your test and you're like, okay, well, that's me. I'm going to have to retake my test. And so here I am, facing those very hard odds. Well, let me just tell you, we are not here for just the first-time test taker. You have found us. We are here and we can help you. Hurst Review is for all test takers. We can provide you with a very, very good review that will get you ready to walk into that test with encouragement and confidence that you can pass the very first time, and then if you're taking it a second time, that you can pass that too. We get you right where you need to be. NCLEX is a safety test designed to protect the public from unsafe nurses, and you're like, well, I've heard that. My teachers at school have told us that, and so here you are, Hurst Review, telling us that again. What exactly do you mean by that? I mean, with every answer, you are communicating to the people that are writing the test and grading the test whether you're going to be safe or not. And we're going to teach you here at Hurst Review how to pick answers that are safe and protect the public, okay? This test is also unlike any test that you've had in nursing school, and we're here to prepare you for that. See, in nursing school, your teachers have to have content that's based off of something they provided to you, whether that's a PowerPoint or something in an e-textbook or a video. They have to have somewhere that they can back up their questions. That's not how it is with this NCLEX test. NCLEX can test you on any question and in any way that they want to. They are going to make sure that you are using clinical judgment and critical thinking to answer these questions. And at Hurst Review, we can help you do just that. So what's going to happen next is there's going to be a question that's going to pop up on the screen. I'm going to give you a few minutes to read through that question. You're going to put these in order of who you would see first, okay? Priority order. And then I'm going to come back on and we're going to go over it together. Okay, so this question says, in what order should the nurse assess assigned clients following shift report? So you've just gotten shift report on all 4 of these patients. Now I know many of you probably looked at number 1 and thought back to nursing school, A, B, C. airway, breathing, circulation. But y'all, that does not always work. That rule is a good rule. Airway, breathing, circulation, those are the order of a lot of things. But you cannot just be so focused on that you don't see something else that's more killer. When you're putting things in order, you have to think to yourself, who is going to die first if I don't go and see them? So now let's look at option number 3. It says a client diagnosed with Addison's disease who is lethargic, has a blood pressure of 86/48, a pulse of 120, and respiratory rate of 24. Are any of those vitals in option number 3, any of those vital signs, are they normal? They are not. And y'all, we teach you in Hurst Review, when you've got a systolic pressure less than 90, you need to be thinking about this patient and worrying about them, because are they getting adequate perfusion? They're not. Anything below 90 systolic, you've got about 20 minutes to get in there and turn them around before they have acute tubular necrosis, which is damage to the inside structures of their kidney. I also see that they're an Addison's patient and they're lethargic. And those vital signs, y'all, they are in an Addisonian crisis. They could go into a fluid volume deficit. With Addison's disease, y'all remember there's not enough steroids, and so we have to add the steroids back. They are lacking glucocorticoids, mineralocorticoids, and sex hormones. They're missing all of those. The main thing that they're missing with Addison's disease is the mineralocorticoid aldosterone. Aldosterone makes you retain sodium and water. Y'all, if you do not have the retention of sodium and water, you could go into shock, which is where this patient looks like they are, correct? 86/48, a pulse of 120, they are shocky. If I don't go down there and see them first, they could die, okay? So that is your first option. Now, we do want to go and look at this client that is diagnosed with respiratory failure, who is on the ventilator and requiring frequent sedation. Here's the deal though, guys. They have a secure and protected airway. The only reason I'm choosing them second is they require frequent sedation. They require frequent sedation. They have a ventilator that's doing the work for them. It's breathing for them. Some of you saw respiratory failure and you wanted to see them first. But with very low perfusion, as we had in option 3, you've only got minutes to turn this patient around, about 20 minutes. So let's go see our respiratory failure patient second. Now, who are we going to see third? That leaves us with a post-thyroid patient that's got a negative trousseau, and then it leaves us with our lung cancer patient with iatrogenic Cushing's. Well, let's look at the last one. Let's look at the client diagnosed with lung cancer. Look at those ABGs. Are they normal? They actually are, right? Some of you saw the 88 with the PaO2 and you got a little scared. But y'all, this is an arterial blood gas, and your normal oxygen arterial blood gas is between 80 and 100. So they are perfect, right? They are perfect. Now, what do we know about Cushing's disease? Well, Cushing's could be caused by our interventions in this option. It says iatrogenic, meaning the things that we have done have caused this. We have given them too many steroids. Cushing's is too many steroids. It's been caused by our interventions to help with their cancer. Some of you may have confused iatrogenic with idiopathic. Y'all, idiopathic means we don't know what caused it, right? Sometimes terms get all jumbled up. Cushing's is too many steroids. So that patient is the one we're going to go see third. That patient that has cancer, and they've got ABGs there for you, but they are number 3 as far as what we're going to go see. So who are we going to see last? We're going to see our patient that's doing beautifully. They've had a thyroidectomy. When you have a thyroidectomy, we do worry that maybe they've gotten some of their parathyroid glands. Y'all remember the thyroid is right up here and it's shaped like a butterfly. And on the back of each one of those wings, is a parathyroid. And parathyroids secrete what? They secrete calcium, that's right. We're worried after a thyroidectomy about calcium dropping. Well, with Hurst Review, and when you take our review, we teach you things like, with calcium, think muscles first. With calcium, think muscles first. Well, if you had a patient that went very, very low on their calcium and you put a blood pressure cuff on them and you took their blood pressure, they could have a positive trousseau sign, which is where the hand curves in. That trousseau sign, and it trembles, right? Well, y'all, this one's negative, which means their calcium is just fine. And so this patient is 2 days post-op. We don't see any signs of hypocalcemia. Fantastic. They're the most stable of these 4. So your order is we're going to go see our Addison's patient first. Then we're going to go see our patient that's on the ventilator and has had respiratory failure but now has a secure airway. Then we're going to go see our patient that has lung cancer. They've got Cushing's disease, but they've got a beautiful set of ABGs. And then lastly, we're going to go see our 2-day post-op thyroid patient. While we're here, let's just do a little bitty snippet of what you might see in our review. Some things that will help you to know, what is Hurst Review all about? So we're about core content. And one of those things that you must know without a doubt and without hesitation is the 4 actions of glucocorticoids. So let's go over those really quickly together. Well, the first thing says they change your mood. And you're like, well, that's a pretty broad statement. What do you mean by they change your mood? Well, it's different for different patients. Sometimes a patient will get a glucocorticoid and they feel euphoric. They're energized. They get their whole house clean in 30 minutes and they love the way they felt on this medicine. So we say they change your mood. Some patients are irritable. Some have insomnia. Some have hypersomnia. We can't predict with each patient how they'll respond. So we just say they change your mood, okay? The second thing is they alter your defense mechanisms. And you're like, well, I knew that one. I knew that when patients get steroids, they're immunocompromised, and they are. So it alters your defense mechanisms. When you're on your test and you're making room assignments, let me just tell you that every word and every question is there for a reason. And if they tell you the patient is on a steroid, you need to be thinking, if I've got to make a room assignment with this patient and they're on a steroid, they're immunocompromised, and it affects who you put in that room with them. Okay, so that's the second thing. They alter your defense mechanisms. Now, the third thing is they inhibit your insulin. So, if I were to take your insulin right now inside your body and I were to pull it backwards, I were to lower your insulin, what's going to happen to your blood sugar level? It's going to go straight up, right? It's going to go up. So these patients that are on glucocorticoids for an extended time, you may find yourself doing some finger stick blood sugars and having to give them sliding scale insulin. It's part of it. Steroids inhibit your insulin, okay? And the very last thing is that steroids promote the breakdown of protein and fat. Well, when you're on steroids for a really long time, you can lose weight in certain places and you can gain weight in others. You can have skinny little arms and legs. You can have a big old moon face. You might have that little hump at the base of your neck. And y'all remember, children that have been on steroids for a really long time, they don't grow appropriately. They just don't grow correctly. It stunts their growth, right? Y'all, this is core content that we just went over. If I were to call you the night before your exam and you had taken Hurst Review, we would want you to know the 4 actions of glucocorticoids so that you could get your Cushing's and your Addison's questions correct. All right, it's a comprehensive review. We do go over core content, but we also go over lots of questions with you. So we have a complete, comprehensive review that you will love. Something else that we teach you is to think like a brand new nurse. Think like a brand new nurse. Think NCLEX and think safety, safety, safety. And you're like, okay, talk to me a little bit more about this brand new nurse thing. Y'all, there are people that will be taking this exam for the very first time and went through nursing school, but they have history in medicine. Maybe they've been a paramedic or an EMT or a CNA or an aide of some sort at the hospital, or maybe they were a medic in the military. You bring all your experiences with you to school and to this test. You have to leave all that experience at the door when you sit and take this test. You probably have learned that in nursing school and trying to take those tests, because what you see practiced is not always what is safest. And this test is for the brand new nurse, and it is all about safety. It's about picking the safest answer. So you have to think like a brand new nurse, and we teach you how to do that. The next thing is we want you to think NCLEX. Well, what do you mean by NCLEX? What we want you to do is, in every question there's a problem. We want you to find that problem and pick an answer that fixes the problem. We want you to assume the worst. Some of you are like, well, our teachers told us in school never assume. Well, you don't read into questions. We want you to assume the worst in every one of these questions, because there are no happy NCLEX questions. In every question there is a problem, and your job is to figure out what is going on and fix the problem. That's what we mean by think NCLEX. Pick an answer that is safe but also fixes the problem. Y'all, when you answer a question and you've got 4 options there, or maybe you've got 10 options there, every one of those options you need to filter through your mind. Does this fix the problem, and does it do it safely? All right, so what do we have to offer you here at Hurst Review? We have some free events for you. We have mini reviews, which go over a small amount of content, and then we do questions with that content just for you to be able to practice. We have NCLEX challenge times like what we're doing right now, and then we also have NCLEX 101, which is just information, because we feel like if you're informed about this test, you can walk into this test more confident. There's a QR code on your screen right there. Get your phone out. I know you've got it close. Take a picture and see what we're offering you for free. Once you see all the things we have to offer you, you're going to be like, I am loving this. They've got a solid foundation. They've been around for 30 years, and they do one thing. We do one thing here at Hurst Review, and that is to get nurses ready to take their board exam. If you don't happen to have the QR code, or your phone's acting wonky or something, you can just simply go to that address that's the very bottom of the screen, HurstReview.com/free-events. Don't want to miss out on those. They are great. They help you get ready for this test. Once you decide, hey, I do love everything about Hurst, I feel like it's a solid program, it's been around for 30 years, they have a 98% pass rate, I am signing up for Hurst Review like right now. We want you to be able to get that at a discount. So for you guys that are on here, we're offering a discount code. In-stream is one way that you can take Hurst Review, and that's where it's streaming live like we're doing right now. There's a teacher, there's a chat box, you can talk back and forth. We will give you $40 off of that with the code FREE2025. You see it listed there on your screen. Hurst Now is a video series where the videos come to you in an email, and then you can watch those at your own time. There's not interaction with a teacher, but it's much more flexible schedule. So if you can't set aside 3 days for our review like we offer in in-stream or our live review, Hurst Now may be exactly what you need. We also have Now Plus. Students for years have asked us, okay, so I took your review. Can you help me formulate a study plan? Like, how much should I do in a day? How should I lay this out? How should I go forward and study? Since they asked for that, students asked for it, we gave it to them. And we have $25 off of that using that code. On that screen's a lot of information, guys. We've got our main website, which is HurstReview.com. We've got a phone number where you can talk to one of our staff here about our review and ask any questions you might have. And then we have an email. Ashley Griffin's one of our faculty instructors. She's wonderful. She'd be glad to talk to you. You can email her at ashley.griffin@hurstreview.com. And then we also have different ways that you can contact us on social media. We are here for you. We have a huge heart for students. All of your teachers at one time were in nursing school and getting ready for their board exam too. We know exactly how important this test is to you. We know what it's going to feel like when you pass it, and we're here to help you do that. We have a great review, and we hope that you will take Hurst Review. For now, I'm going to tell you again that I hope you have a wonderful day, and tune back in and see us sometime. Bye for now.